am Ashley Parker, and I'm a geriatric social worker and consultant. I am the owner of Compassionate Consulting, which is a care planning service for seniors and their families. We serve as a resource, a guide, and an advocate for families in helping advise on care planning decisions. And the topic that I'm going to talk about today is navigating the healthcare continuum, which I think is a very important and timely topic. I work with a lot of families who are absolutely overwhelmed and stressed in trying to manage the care of their loved one. And they tell me, I don't know what I don't know. They don't know what resources are out there or really how to access those resources. And I think a lot of the struggles that they face is because they simply don't have a plan of care. I ran across a really interesting statistic that came out from AARP. And AARP found that only 1/3 of seniors had done any sort of life care planning. Yet 70% of those over 65 had the need for some sort of assistance. So, that's a wake-up call for all of us. And I think that, I think it's really easy to understand why this happens, because having a conversation can be difficult and uncomfortable. And a lot of times we don't want to think about our loved ones becoming debilitated or needing more care. So we're just real apt to put our head in the sand and not deal with it. And I'll tell you that professionally, I help families all the time with developing care plans. But personally, I have sat down recently with my parents, and I will tell you, it was a little uncomfortable, the conversation at first. But I will tell you the benefits of having a conversation and having a plan far outweigh any kind of discomfort that you might feel. So I'm a real advocate of sitting down and making those care plan decisions. And one of the first things that I think are important to consider in making a plan is legal and financial issues. And I know that there's a session that Richard Courtney is offering at Caregiver University, and it's on making it's legal and financial. And so I'm not going to spend a whole lot of time on that, but I do want to encourage you all to make sure that your loved one has a power of attorney for health care and for finances, especially if there's a diagnosis of dementia. It's important to have those conversations early when they're still able to make those decisions. It's also important at this point to do a financial inventory and find out what your loved one's income and assets may be, because that's certainly going to impact care decisions. You also want to find out if your loved one may be eligible for any benefits, such as VA benefits or Medicaid for planning for skilled nursing care, or see if your family member has a long-term care insurance policy. Those can be really helpful in paying for care, whether it's in-home or in a residential setting. So do that. Also, I think it's important to let your family know where your important documents are. Let them know where your bank account information is, your credit card information. If you all have any investment accounts, knowing where that information is, marriage licenses, warranty deeds, car titles, long-term care insurance policies, all that's really good. You need to let your family know where that is. And something that families don't consider is computer passwords. You need to let your family know what your computer passwords are. Along with that, I think informing your family about who your healthcare providers are is important, and letting them know a list of medications to have on hand. That's really helpful to have. In some instances, it might be good to consult with an elder care attorney, and those can be really helpful in guiding families. So those are just a few things to start with. I think the next thing you want to think about is what level of care does your loved one need? How do they function on a day-to-day basis? How are they ambulating? Are they able to walk without an assistive device? Or do they need help? Do they need to use a cane or a walker or maybe a wheelchair? What does that look like for them? You might also want to find out if they might need some help with bathing or dressing. You may go over to your loved one's house and notice that they're not dressed appropriately or might look like they haven't had a shower recently. So take note of that. You want to find out if they're able to prepare meals independently, or are you going to their house and finding that they're leaving pots on the stove and food is burned, or if you open the refrigerator, are you seeing that food is spoiled? Assess that. Other things to think about are, can they pay their bills independently? Are you going to their home and finding that they're unpaid bills, or maybe the power's been turned off, or something like that? Along with that are they able to manage their medication independently? Are you going over and finding that perhaps they're not taking some of their medicine, or maybe taking too much of it at a certain time? So look at that as well. Another thing to consider is, have they had a lot of falls in the home, or have they had to take a lot of trips to the hospital? You want to look at the home environment. If they are having falls, are there certain trip hazards in the home? Is the home safe? Are there throw rugs all over the place? Is the lighting appropriate? Really, those are things to consider in the home environment. And then the last thing I would look at would be, where are they in the disease process? Are they in the early stages of dementia, or have they moved along to more the mid or the late stages? So think about that when you're doing this initial assessment and what their needs may be. And then you might want to look at what sort of care setting is appropriate for them. I think most people want to age in place or age in the home where their memories are, their family memories are, and their history is. Of course, this isn't always appropriate, and we're going to get into that a little bit later. But certainly if the decision is made to stay at home, there are resources out there to help the person stay safely in their home. One of the first things I want to talk about is home health. And the person's doctor can order home health in the home, and that can consist of a nurse who's coming out to check on the patient, physical therapist who maybe can do some strength and mobility training, possibly an occupational therapist or a speech therapist. Now, Medicare and private insurance normally cover these services, but they're very short term, and that's what I like to remind people. It's not something that you really should rely on for any kind of long-term care, but certainly they can help in the short term. Another thing that can be helpful, technology is just improving day to day, and there are all kinds of devices that can also help somebody stay safely in their home. The Medic Alert system can be invaluable to families, and what that consists of is it's normally a device that someone wears around their neck or possibly on a wristwatch. And if they were to fall in the home, they could press the button and that would alert someone to come check on them. My 88-year-old mother-in-law, who lives alone, has one of these devices, and she has fallen several times, and they've contacted us, and we've been able to get her the help that she needs. And again, that has just been a wonderful resource for us. There are other devices such as medication reminders. If you have a loved one who's having trouble remembering to take their medicine, there are devices that can give them reminders and actually dispense the medication. So that can be a great tool. Some families use home monitoring devices. Those are cameras that are set up in the home, and the family can check on what their loved one's doing, throughout the day, and just ensure that they're safe. That can allow somebody to go back to work, or maybe if they're in a different home, they can monitor that. Telehealth is huge these days, and I know certainly the Mind Center is doing a lot of telehealth visits, and Dr. Tarver mentioned the other day, I thought this was really interesting, that it was really helpful for her to see her patient in their home environment. That gave her some really good feedback. So there are really a lot of benefits for telehealth. It's certainly a lot easier for patients and families. Does not replace an in-person visit, but certainly is a good additional means of monitoring health. Other things to think about if someone is to stay at home is making home modifications. And sometimes if you have home health, the physical therapist can make recommendations about different things that can improve safety in the home, from installing grab bars in the shower or having a shower chair. Having a raised commode seat is also very helpful. Having handrails, or possibly a wheelchair ramp. Those are all things that, modifications that can be made in the home to improve safety. If your loved one needs more care, there are some non-medical caregiver services out there. And there are really two ways to go with this. Folks can hire someone who works privately, or they can contract with an agency to provide services. And there's certainly pros and cons of both that I want to point out. Some families choose to use a private caregiver because it may be less expensive for them. Others may choose to use a caregiver service. A caregiver service actually has employees who are licensed and bonded, and they do background checks, and they take care of any kind of payroll paperwork or any kind of taxes or workers' comp. So that may be a benefit for using a caregiver agency. Also, if a caregiver gets sick, if someone is using an agency, it's really easy to send someone else out there. Or possibly if your loved one has a personality issue or doesn't like a particular caregiver, it's easy to bring somebody else in. Also, I want to say that some long-term care policies will only reimburse for caregivers through an agency. So again, just things, I'm not saying one's better than the other, but just things to consider. Another wonderful resource is adult daycare. And I think this is overlooked sometimes, but adult daycare provides a very secure environment where you can drop a loved one off. It can be for a few hours, it can be half of the day, or a full day. And that can really give the caregiver a break or a respite. Caregiver possibly can even go back to work if their loved one is able to go into one of these communities. And adult daycare traditionally has a nurse who's available to dispense any kind of medication that's needed. They have a social worker and activity director. They provide meals throughout the day and snacks. They have activities, and they just provide that socialization that is really helpful for a lot of seniors. Some adult daycare centers even provide transportation, so that can be a huge relief or a burden lifted for families. Respite is something else that can be very important for caregivers, just having a break. The VA offers some really good respite programs, and families can utilize respite services at some assisted living facilities as well. If families need to go somewhere for the weekend, or they just need a break for a few days or maybe a week, they can pay a per diem or per day rate for this respite service. If families need transportation, there are transportation resources. This could be to take a loved one to the grocery store, or maybe for a hair appointment or a doctor's appointment. There's also transportation resources for those who are wheelchair bound. So those are good to know. There is another resource that deals with money management. It helps seniors with bill paying, writing checks, filing insurance papers, helping with tax returns. So So again, that can be helpful, particularly if the family member lives out of town, or if the family's just too busy and they want somebody else to take on that function. The last thing I'm going to talk about in terms of in-home resources is hospice. Hospice provides a very holistic approach to care. I'm a big proponent of hospice when it's needed. Of course, you have to have a doctor's order, and it's for someone who has a terminal condition, usually 6 months or less to live. Hospice can provide those additional services. They can provide a nurse to come out to the home, a nurse's aide who can help with bathing the person, a social worker, a chaplain, volunteers, and a bereavement counselor once the person dies. Hospice can also provide equipment in the home. They can provide a hospital bed, oxygen if needed. They can provide incontinence supplies, and they can help pay for medication that's related to the terminal illness. So there are a lot of benefits for using hospice services in the home. Now, there are a lot of times when it's just not reasonable or realistic for someone to remain safely in the home. And there are a lot of reasons for this. It could be that a spouse was taking care of their loved one, and maybe the spouse becomes ill or dies, and there's no one else who can take over those caregiver responsibilities. It could be that the person just needs more medical care and needs to transition to another level of care. Certainly when dementia is involved, there are some dementia behaviors that may make it difficult to remain in the home, such as wandering. I've had several conversations with people whose loved ones have wandered out the front door, and the police have had to be called, and the police have brought their loved one home, and that just creates a lot of anxiety. Caregivers aren't able to sleep or relax. So that may be a reason that a move might be necessary. Or it could be behaviors like agitation or aggression, and the caregiver just can't manage those anymore. Sometimes I find that incontinence can kind of cause someone, and this kind of sounds funny, but a lot of times if an adult child is taking care of a parent, say an adult son is taking care of his mother, and she becomes incontinent, and he's really not comfortable providing that care, that may be what tips the move to a residential setting. Or maybe just overall stress of the caregiver. They're just exhausted. Maybe their health is being impacted, and so they need to think about making a move. So there are lots of different levels of care in care communities and residential settings, and so I thought I would talk briefly about what those are. The first level of care is the independent living community. And this is for somebody, as the name, as you would expect, somebody who's pretty self-sufficient. They can take care of their activities of daily living. They may just be looking for more maintenance-free living. They may be tired of trying to take care of their house or their yard. And so they move into an apartment where they don't have to worry about those things. Usually in independent living, meals are provided. A lot of times transportation is as well, and they have activities for folks to participate in. So maybe if someone were living at home, and they were isolated and lonely, a move to an independent setting might be very beneficial for them. The next level of care would be the assisted living, and this is for someone who needs more care. They may need help getting bathed or dressed, or they may need help with medication management. Meals are provided here as well, and a lot of assisted livings also have physical therapy departments in-house that the person's able to access. The next level of care would be a memory care unit in an assisted living facility. And what this involves is it's a more structured environment, usually structured and secure as well. Usually the staff who are in this environment are trained in dementia care, and there's a smaller staff to resident ratio here. Again, there are activities that are provided, meals are provided. A lot of times they'll have a dietitian who can monitor weight and make recommendations if the person starts losing weight or if maybe they need a change in their diet. So they have social workers who also consult as well in memory care units, and this can be a really good option for families. The highest level of care would be the skilled nursing care, and this is usually for folks who are more in the end stages of the disease, where they need more intensive medical care, and they have nurses on staff 24 hours a day to provide that care. There also is something called continuing care communities, and what these are it runs the gamut. They have independent living, assisted, memory care, and skilled care. So the person can move in and transition through that continuum as their condition changes and they need more help. Also want to mention geri-psych inpatient facilities. Sometimes, especially with dementia, there may be behavioral issues that need to be addressed, and the doctor may feel like it would be beneficial or helpful for the person to go into a geri-psych facility. And this could consist of just being in for a few days or a few weeks. And during that time, their medication might be managed and adjusted in order to help relieve some of the symptoms that they were experiencing. There are also inpatient rehab centers, and usually people will go to an inpatient skilled care rehab facility following a hospitalization, where they're in the hospital for 3 or more nights, and they might need some more intensive therapy to kind of get back to where they were before. And so they'll go in for a period of time, and usually Medicare and private insurance will cover that payment. At least it's usually 100% the first 20 days, and then a percentage up to day 100. There is also inpatient hospice. I know I talked a little bit about hospice in the home. Hospice can follow care. Hospice can be provided in assisted livings, in nursing homes, that kind of thing. But also there are specific inpatient hospice facilities where they provide that specialized hospice care. So I like to remind folks about that and let people know that's available. So how do you choose a care community? I think the first thing, of course, is you want to determine the level of care that your loved one may need. And if you're not really sure about that, you can talk to your doctor or social worker about what they think the level of care your loved one may need. You also want to consider the cost of the care. Of course, the lower levels of care are not going to be as expensive as the higher levels, such as skilled nursing care. And you're going to have some difference or differentiation, that's hard to say, between different residential settings. So that's something to look into. Geographical location. It may be important for you to find some place that's close to where you are so that you can visit your loved one regularly, and that's convenient. You might also want to think about amenities that the different residential settings provide. Some assisted livings are very fancy, and they may have like a movie room. As I mentioned, a lot have the physical therapy. Some allow pets, so that might be something you want to consider. And you might also want to see if they have a courtyard or secure walking trail or things like that are important to you. And above all, you want to find out about availability. What's open right now? Do they have a spot for your family? And I like to tell people that if you think that nursing home care maybe in the near future, I would recommend going ahead and putting your name on list at nursing homes, because it can be very difficult and challenging to find a skilled nursing bed when you need it. So please plan early. I think it's also important to schedule a tour and do a site visit at some of these places that you're considering. Of course, this can be a little challenging in the day of COVID. Some places may not allow on-site visits. You may have to really do a virtual tour. But some places that I've been talking with are allowing people to come in and see various parts of their communities. So I would absolutely schedule a tour, and then if at all possible, go back again. And you might want to go unannounced for the next visit if they'll let you in, and maybe even at shift change, and see how that transition is for staff. You want to have your list of questions when you go in, and I'm going to talk about some of these questions. Of course, the resource guide also, I've borrowed some of those questions from the resource guide, and I want you to feel free to refer back to that at any point. But you want to ask about the training that the caregivers are provided from the facility. Probably another good question to ask is your loved one able to age in place in the community? Or what instances would necessitate a move to a higher level of care? That's important to think about. You might also want to ask about family support groups or family council meetings. I'm going to talk about that a little more in depth in the next few slides that I have, but it's good to know if those are available. And then you want to ask about what the communication looks like. So I think it's also important to ask about how often care plans happen in the community, or how often they're scheduled. Care plans are so important to have, because it's important to know, for the family to know what kind of care is being provided their loved one. And some of the things that they go over in care plans are things such as, how often is mom or dad getting a bath? How often is her laundry done? Is she taking her medicines? Are they having any trouble with her taking her medicines? Is she eating her meals? And what percentage is she eating her meals? Is she participating in activities? That's really good feedback for families to have. Some other questions to ask are things like, what approaches are used when providing care? If the person is getting confused, does the staff try to redirect? Is that an approach that they might use? And then you also want to ask about how the staff manages challenging behaviors. What do you do when mom doesn't want to take a shower? How do you all handle that? It's important to know. And then also, how do you encourage hydration and nutrition? Are there snacks that are offered on a regular basis? Or does the residential community have a hydration station? Hydration, of course, as you know, is so important in reducing urinary tract infections. So it's important that our loved one gets proper hydration and nutrition. You might also want to ask if residents are allowed to make choices and decisions. I think this is hugely important. I think a lot of our seniors are really robbed of their ability to make decisions. And this doesn't have to be a very complex thing. A care provider can just, for instance, say, well, Mrs. Jones, would you like to wear your green pants or your blue pants today? Or would you like an apple or a banana for your snack today? It's just so important for their own dignity and self-worth to offer some choices. So do ask how they manage that. You might also want to ask how families are notified of care needs or changes. What does that line of communication look like beyond the care plan meeting? What is the regular method for that? If you are able to go into a facility, I think it's important to make sure to look and see if it looks clean, if it smells clean, if the residents look like they're well-groomed and happy. You might want to take note of how the staff talks to the residents. Do they treat them with respect and use kind words with them? You might also want to see if you're able to be there during an activity period. See if the activities look engaging and appropriate. I have a real pet peeve when I go into some of these facilities and I see people just put in front of the TV for hours on end. That is not appropriate. That's not an appropriate activity. You also want to, if you're able to look at the meals that are being offered and see if they look and smell appetizing. There are also some very concrete measures that you can look at in evaluating facilities. Medicare.gov has a website that has a nursing home compare, where you can look at nursing homes, skilled nursing facilities in your area, and they have a star rating system, and you can really get some good information from that. You might also want to talk to some families who have loved ones in the facility and get that firsthand information about how they think that facility is performing. You might also want to ask other professionals, doctors, social workers, others in the community that might have some information for you. So when you come to the point where you're trying to reach a decision about making a transition to a care community, I think it's important to, again, start this conversation early with your loved one and try to involve them as much as possible in that decision-making process. It may not be possible if the dementia is advanced, but if at all possible, try to start early with these conversations. You might want to use some empathetic wording or phrasing, such as, you know, Mom, I'm really worried about you, and I'm thinking you might need some more care. What do you think? You also want to try to engage the whole family in the conversation and utilize your medical team. I'm so impressed with doctors today who are being very proactive in bringing the subject up and saying to the family or their patient, you know, I think it's really time that we start to think about assisted living or nursing home. You might also want to tell your loved one that, you know, why don't we just give this a trial run? Why don't we see how it goes? You may be surprised and really like it, so let's just give it a try. If at all possible, if you're able to take your loved one possibly to have lunch at the facility or engage in an activity that's scheduled. I know with COVID restrictions this may be hard, but if at all possible, that might be helpful. If this is not possible, sometimes you can give your loved one a virtual tour of the community or show them what the apartments look like. That can help reduce some stress and anxiety for them as well. And of course, you may need to have several conversations. This may not be, of course, it's probably not going to be one conversation. This is probably going to involve several conversations over a period of time to gain that acceptance. When you're actually ready to make the move, I think it's important to recognize that in most cases, the move's going to be stressful. I mean, just the logistics of downsizing can be overwhelming. Moving from a house, from someone at home into an apartment or a room, just physically, that can be very stressful. I want to tell you there are some resources out there, people who you can contract with to help with that. I think it's also important to think about, you know, the losses that your loved one may be experiencing with a move, such as loss of their familiar. Maybe they've had a pet at home that they are not able to bring to the community, or maybe just some of their belongings that they're used to. I try to tell families to set up their apartment or their room with as many things that are familiar to them, their favorite possessions, maybe pictures, blankets, a favorite chair, anything that can make it seem more home-like, that can help with the transition. A lot of times caregivers are going to feel guilt or sadness in the move, and that's certainly very normal. Some might actually even feel relief, and that they're relieved from the stress of their daily caregiving responsibilities, and they know that their loved one is in a setting where they're going to get the care that they need. But if a family member is having some emotional issues, I would suggest that they speak to a social worker or another mental health professional to try to deal with some of these emotions with the move. They can also talk to staff and that can also reduce anxiety and knowing what to expect with the move. The admissions coordinators work with families all the time, and so they can provide really good feedback to families and help reduce some of that stress. I think with the adjustment period, it's important to know that there can be some difficulties with adjustment, and I think it's just good to allow some time for adjustment. Sometimes staff at the residential care communities will encourage families to wait a few days before coming to visit so that their loved one can get used to the staff and the staff can get used to them, and they can get used to the structure and environment and the schedule of the communities. So look to the staff and see what their recommendations may be regarding that. I think it's also important to share as much information as you can with the staff about your loved one. Some communities will give families a questionnaire or life story questionnaire, and they can ask important questions such as where was the person born? Where did they grow up? Did they have brothers and sisters? Where did they go to school? Did they have any favorite childhood memories that they can recall? Maybe information about where they worked, what they did for a living, if they have any special accomplishments that they were recognized for. Information about who they married and their children. Maybe their hobbies, what they enjoy doing, and then likes and dislikes. And having this information can really help the community plan a person-centered approach to care and plan activities that they think that the person might really enjoy. Or actually, it can be beneficial in just having a staff member reminiscing with their family member about something that was important in their past. It can help build relationships. I think it's also good to do a lot of reassurance once your loved one moves into a community. Tell them that, it's a safe community. There are a lot of really good people who are going to provide really good care for them, and that you're going to be there for them, and you're going to come visit, and you're going to walk with them through this journey. Another good thing to do is to attend those family support groups. That is a good way to kind of orient to the community, that residential care community, get to learn staff, get to know staff, get to know other families, and maybe learn what their experiences were when they moved their loved one in. That can be very reassuring. I think you also want to have realistic expectations about the care that's being provided, because it's not going to be the same as when the person was at home. They're not able to have that one-on-one care. So just try to be realistic about that. And then be an advocate for your family member. Visit often. Develop a relationship with the staff. Get to know them. It's really hard being a direct care worker. That's hard work. And so I think it's important to recognize the good work that they're doing, acknowledge that. That definitely helps build a relationship with the staff. And then I think another thing is to try to remember the goal that you have. Remember that the overall goal in the transition is really trying to improve the quality of life of your loved one, and the decision is based on really what's what's best for them. Also try to focus on the positives that the person is able to have in being in a care community, such as medical care. They're able to have that, the nurse who's there and can provide the medical care, proper nutrition, medication management, socialization, having those activities, having people around is really good. Having the benefit of trained staff, people who know how to manage dementia care, and having the structure that a care community can provide is also very good. And then I think you can realize that you're more rested. If you don't have all those day-to-day caregiving responsibilities, you're more rested and you're able to enjoy quality time with your loved one and be the adult child or the spouse and really be in that role more. Okay, I know I've given you a lot of information. It may be a little overwhelming, but I want you to know that there are resources out there to help you. And I want to tell you that support groups, caregiver support groups can provide you a lot of information about resources out there. So I would encourage you to attend some caregiver support groups. Social workers at hospitals and also in clinics can also help direct you and provide information. Alzheimer's Mississippi and the Alzheimer's Association have wonderful websites that provide a plethora of information for you. And they also have care consultations, which are free to families, and those can be talking to somebody and really kind of trying to hash out some of these care planning decisions. Of course, geriatric care managers can be objective evaluators who are very knowledgeable about local resources, and they can also help direct care. So, and of course, the resource guide is another resource that you can put your hands on and refer back to that have a section on information and referrals. So I would absolutely encourage you to use that. So I have been delighted to have the opportunity to speak with you all today and to participate in Caregiver University, and I hope this information has been helpful. Thank you.